Hello, I will be presenting my nurse educator for suicide screening at Colorado State University under the guidance of Dr. Peg Rooney as partial fulfillment of the oral comprehensive examination. By the end of this presentation, you'll be able to understand the critical role nurses play in suicide screening among active duty military personnel and recognize why confidence in suicide risk identification is essential to safe clinical practice. You'll to examine the structure, educational interventions, specifically workshop focused on suicide screening tools, influence nurses' preparedness and confidence in conducting suicide assessments. This presentation will also present a focused nursing education case study to demonstrate how insufficient preparation may affect clinical decision making and how to target educational strategies can address this gap. Current literature addressing suicide prevention education, simulation-based learning, and confidence-building interventions will be reviewed through a structured evidence table to provide an evidence-based foundation for the discussion. The presentation will identify significant gaps in existing research, particularly those related to military-specific nursing education and long-term confidence retention following the training. Finally, implications for advanced nursing education practice will be explored across classroom, laboratory, and clinical teaching environment. Suicide among military personnel remains a serious concern and continues to affect both active duty service members and veterans. In 2024, 471 service members died by suicide, and veterans continue to experience a much higher risk than civilians. These numbers show why targeted prevention and screening education are so important. My question asks whether nurses working with active duty military personnel become more confident in identifying suicide risk after participating in a workshop on suicide screening tools. The 3-month follow-up matters because it shows whether learning is retained, not just immediately remembered. This question is important because nurses are often the first professionals to notice warning signs. Suicide in active duty population is a major public health and operational problem. Service members often face deployment stress, trauma, isolation, and stigma, which can reduce help seeking. Nurses are in a key position to notice subtle warning signs and start screening early, making education a patient safety issue. Even though suicide prevention is widely recognized as important, preparation in suicide screening is still inconsistent. Many nurses only receive informational exposure through orientation or observation, which may not build confidence. Structured education is needed because nurses are more likely to screen effectively when they have guided practice and military-specific examples. This case study involves a newly assigned nurse in a military outpatient clinic. The nurse saw a service member with insomnia, irritability, fatigue, and withdrawal, but lacked confidence and formal training in suicide screening. The missed opportunities show how limited preparation can affect clinical decision making. After that experience, the nurse completed a structured workshop focused on suicide screening tools and military risk factors. Through simulation and practice, the nurse learned how to ask direct questions, interpret responses, and making referrals. 3 months later, the nurse recognized similar warning signs and confidently screened the patient, showing how education can change practice. Patricia Benner, novice to expert theory, helps explain this growth. Nurses begin with rules and guidance, then improve through experience, reflection, and repeated practice. In this case, the workshop helped move the nurse from uncertainty towards stronger clinical judgment and confidence. David Cole's experiential learning theory also fits this topic well. Nurses learn best when they actively participate, reflect, and apply what they have learned in practice. Simulation and debriefing are especially useful because they turn information into skill and confidence. Effective suicide prevention education should be structured, realistic, and active. Workshops should move from basic concepts to practice scenarios that reflect military life, such as deployment stress and stigma. Feedback, debriefing, and repeated rehearsals help nurses build confidence and improve communication. Evaluation should measure both immediate learning and longer term retention. Baseline confidence, post training confidence, and 3-month follow up are all important. Using both numbers and reflection helps educators see whether the workshop truly improved preparedness and what needs revision. This educational plan aligns with AACN essential domains such as knowledge for nursing practice, person-centered care population health, scholarship, quality and safety, and interprofessional partnerships. These domains support the idea that suicide screening is both a clinical skill and a public health responsibility. They also show how this topic belongs in advanced nursing education. These domains collectively reinforce the advanced nurse educator's role in creating sustainable educational systems that improve learning preparedness and clinical safety. The novice nurse educator competencies are shown through facilitation, assessment, curriculum design, change leadership, scholarship, and working within systems. A nurse educator must be able to design learning experiences that build skill and evaluate whether students are meeting outcomes. This project demonstrates those responsibilities in a very practical way. One of the studies in 2023 examined how suicide-specific training related to emergency nurses' confidence and comfort when caring for suicide patients. At this level 3 non-experimental comparative cross-sectional study of 117 ED nurses from community and critical access hospitals, participants completed an anonymous survey on their prior training, confidence, comfort, and burnout, and perceived competence. Nurses who receive evidence-based expert delivered suicide prevention training reported significantly higher confidence, greater comfort, and lower burnout than those with informal or not training, with different significance of p-values less than 0.05, although the self-report design limits causal conclusion. The sample is adequate and the findings support our question outcome and increase confidence after a structured education. Another study, also in 2023, conducted a level 1 systemic review and meta-analysis of 96 studies, including over 43,000 participants, such as healthcare professionals, students, and gatekeepers. Simulation-based suicide prevention training produced a statistically significant improvement in suicide risk assessment skills, attitudes, confidence, and intervention behaviors, with effects maintaining for 2 to 6 months in follow-up. The large sample, rigorous methods, and inclusions of multiple designs strengthened the reliability and generability of those results, providing a strong support for implementing a structured suicide screening workshop for nurses in military settings. Darnell in 2024 evaluated an innovative educational intervention designed to improve nurses' suicide prevention competencies through virtual learning and simulation. This pilot quasi-experimental study included 18 acute and intensive care nurses who completed an e-learning suicide safety planning program incorporating virtual patient simulations, guided role play, and automated feedback. Outcomes were stressed longitudinally over a 6-month period. Results demonstrating improvement in knowledge, confidence, and perceived ability to conduct suicide-related interventions. While a small group size limits generability, the study provides valuable evidence supporting sustained confidence gained following instructor suicide prevention education. The study presents level 2 and 3 evidence because of its pre-post design and longitudinal evaluation. Reliability was strengthened through repeated outcome measurements and standardized educational delivery. However, the access and control group limits causal inference. Kramer in 2025 developed and evaluated the core competencies model for military. This is a suicide prevention workshop specifically designed for providers serving military populations. The level 2 quasi-experimental pre-test, post-test study involved 35 mental health professionals who participated in a half-day training program. Researchers measure suicide prevention, knowledge, skill mastery, and competencies before and after workshop participation. Findings reveal statistically significant improvement in knowledge and perceived skills, with p-values below 0.05 and moderate to large effect sizes. Although participants were not exclusively nurses, the military-specific focus increases relevance to our current question. Reliability was enhanced through standardized workshops, content, and pre-post evaluation methods. Together, these studies provide important evidence that structured suicide prevention education can improve confidence, knowledge, and clinical preparedness, particularly when educational content is tailored to the population nurses serve. There is sufficient current evidence to support suicide prevention education. However, notable research gaps remain. There are a few studies focusing specifically on nurses working directly with active duty military populations. Most studies consider people across the board. Existing studies frequently involve mixing healthcare samples or civilian practice setting, limiting generalizability. This limitation is important given that military roles expose personnel to major sources of mental health issues such as PTSD and depression. Follow-up periods are often short, preventing evaluation of long-term retention. Sample sizes are frequently small, reducing statistical power. Confidence measurement tools vary considerably across studies, limiting cross-study comparison. These gaps highlight the need for robust longitudinal research examining sustained educational outcomes in military nursing contexts. Implications as a nurse educator. Classroom teaching should intentionally integrate suicide prevention content into mental health and military nursing curricula. Case-based instruction support clinical thinking while promoting contextual understanding. Reflective discussion encourage learners to examine emotional responses and ethical considerations. Then we have conceptual mastery, providing the foundation necessary for later clinical application. On the other side, we have laboratory environment, providing ideal opportunities for experiential suicide screening practice. Simulation supports deliberate rehearsal of sensitive assessment conversation. And then faculty feedback promotes correction of communication errors while reinforcing best practices. Clinical teaching translates classroom and simulation learning into a real-world practice. Mentorship is also essential during early implementation. Outgoing observation and feedback strengthened transfer of learning and ensure confidence evolves into reliable clinical competence. Now it's time to revisit our case study. So by revisiting the case, this demonstrates how educational intervention transformed clinical performance. The nurses increased confidence, enabled direct suicide screening, timely risk recognition, and immediate referral. This outcome illustrates the practical impact of evidence-based education. With such a knowledge, the nurse is well placed to manage any risk of suicide in their post by deploying available screening tools to assess exposure and risk of suicide. This presentation demonstrates that structured suicide screening workshops are an evidence-informed strategy that improves nurse confidence, strengthens clinical decision-making, and enhances readiness for suicide prevention, particularly in military and healthcare settings. The literature shows that structured simulation-based education supports skill acquisition and retention, especially when paired with active learning and reflective practice grounded in adult learning theory and competency-based education. These instructional approaches ensure that training is intentional, practical, and aligned with how nurses develop clinical judgment in high-stakes environments. The intervention also aligns with the AACN essential domains, particularly those related to clinical judgment, population health, and safety, reinforcing its relevance to contemporary nursing education standards. Additionally, the approach reflects novice nurse educator competencies in curriculum design, facilitating the evaluation of learning outcomes, demonstrating evidence, effective translation from evidence into practice, while gaps remain in long-term outcome research and standardization of these implementation models. Current evidence also strongly support workshop-based training as an effective method to improve suicide screening performance and ultimately strengthen patient safety outcomes. This slide contains some of the reference for this presentation. This slide contains more reference for this presentation. Thank you.